I'm here now to demonstrate the joint movements that you learned in Chapter 8. Start with flexion and extension. Most of these are in pairs. Flexion and extension are a pair, where flex means to bend the joint or decrease the angle in terms of degrees. So I'm going here from 90 to, say, 45. That's flexion. Extension is increasing the angle up to 180 degrees or straight. For joints where you can go past that, then it's hyperextension. Most people can not hyperextend their elbows, some can a little bit. Same thing for knees, flex, extend, that's it. For fingers, flex, extend. Same thing with toes, you curl them, that's flexion. For the hips, this is flexion. This is extension. In the anatomical position, everything is extended. Okay. And most of the time, flexing can go further than hyperextension. You see the difference in how far my hip can go. Now with the wrist, that gets a little fuzzy. This is extension. Here's one way. The other way, not that much less, but this one, sending the palms out, is hyperextension. Bringing the palms toward the arm is flexion. Now we can also flex, extend, and hyperextend the spine. Same rules apply. Extension is anatomical position. Flexion is the direction where you can go further versus hyperextension. Same for the neck. Hi, Kaylee, if you can see her. Okay. Next set of movements is a special form of flexion and extension used at the ankle. So I said everything is extended in the anatomical position. That's weird for the ankle because it's at 90 degrees. We can do two movements from there. This one probably for most of us goes a little further, but rather than calling this flexion and this hyperextension, they call them special types of flexion. Plantar flexion, flexing toward the sole or plantar region, is when you point your foot. So the P's go together there. Plantar flexion, point. Dorsiflexion is this movement. It's called that because this is called the dorsum of the foot. Even though it's in front, it's comparable to the back of the hand. So plantar flexion, dorsiflexion. Now, I should also point out the shoulders. Again, anatomical position is extension. That really doesn't sound like it should be because your arms are right against your body. However, that's how we use the terms. Bringing your arms forward like this is flexing the shoulders. Bringing them back is hyperextension. Next we have lateral movements. If you are pulling a body part away from the midline, that's called abduction. Think abduct, kidnap it, take it away. If you're bringing it toward the midline, that's adduction. Sounds like addition. So, easy to see with the arms and the legs. You can also, remember anatomical position, adduct and abduct your wrists. For fingers and toes, it's going away from or toward each other. So this is abduction, this is adduction. Same with toes. Now for the spine, we don't usually say abduction and adduction because it is the midline. So usually this movement will be called lateral flexion. You could specify left or right if you wanted to be more precise. Okay. Next, circular movements. Twisting something is called rotation. For rotation, there's an axis that part of the body twists against. The rotation in the forearm gets special names that I'll come to next. And it's actually occurring at the elbow. If you remember that indented round head of the radius that twists against the humerus and ulna to give us this movement. Shoulders can rotate, and hips. Knees can't unless they're very, very tightly flexed. You can get slight rotation in them, such as in that lotus position in yoga or meditation. Sometimes we specify rotation as medial if you're turning the part toward the midline, or lateral rotation if you're turning it away from the midline. And that can be relevant to looking at details of muscle function in the shoulder, particularly a group on the scapula called the rotator cuff. Okay. So again, here, medial rotation, lateral rotation. For the spine, it's always lateral unless you're coming to the midline, so you would usually say left or right rotation. For the forearm, the special terms are pronation and supination. These come from terms for lying down. Prone is lying on your belly, supine is lying on your back. So if you supinate your wrist, then the back of your hand goes down. If you pronate, the palm goes down. And that, if your arms aren't up like this, the palms would go back for pronation, forward for supination. So everything is extended in the anatomical position. The radial joint at the elbow, which doesn't extend, is supinated. Okay. Another way to remember these: if my hand is supine, I can hold a cup of soup in it. But if I then pronate, I will pour out that soup. There's one other movement that is circular, but it's not twisting, and that is circumduction. In circumduction, the part stays in the same orientation, but it moves around to draw a circle. If you look at the whole area formed by the movement, it makes a cone. Okay. So to compare, this is rotating my shoulder, this is circumducting. Condylar joints can flex and extend, abduct and adduct, and when you put those together, you get circumduction. So I'm first flexing my shoulders, and then I'm abducting them, and then I'm extending and abducting, and then flexing again, or adducting and then flexing again. That's a ball and socket joint, which can also rotate. A condylar joint, like the wrist, can't rotate. If I hold my radius in place here, the wrist can't move. It has to rotate from here. And also the base of the fingers where they meet the metacarpals, that's condylar. You can flex, extend, adduct, abduct, circumduct, but you can't rotate. That would cause your finger to twist. Okay, let's see, what else have we got? Flex, extend, hyperextend, abduct, adduct, circumduct, rotate, pronate, supinate, plantar flex, dorsiflex, tilting the foot. Okay. It is a comparable movement to abducting and adducting the wrist. However, if you look at it, the foot's not pointing a different way like this. It is tilting so that the sole faces a particular direction. If you turn the sole to face inward, that's called inversion. Turn it to face outward, that's called eversion. Okay, I think I'm down to the last ones, which are two more pairs, protraction and retraction, which means moving something forward and back, elevation and depression, moving something up and down. However, these four terms are only used if you can't apply one of the others. You know, I'm moving my arms forward here, but I'm not protracting them, I'm flexing my shoulders. On the other hand, if I did this, I am protracting my shoulders and then retracting them. You can do the same thing with the head, protract and retract, and that's different from flexing and hyperextending the neck. You can also do it with the mandible. And then elevation, depression. Notice that it's the actual scapula that's going here, not the ball and socket joint. The arm is just coming with the scapula. Elevation, depression, and you elevate and depress your mandible to chew. Okay. So if you have questions, bring them up on the discussion board. Thank you for watching.